Today marks 16 years since the Affordable Care Act was signed into law. But for thousands of Virginians, access to coverage is now becoming more difficult. At a virtual press conference today, some lawmakers pushed to restore key funding that helped keep health insurance affordable. Jordy Clark explained what's at stake and what options people still have.
For many Virginians, the cost of health care is going up while coverage options are shrinking. More than 44,000 people in Virginia have dropped their Affordable Care Act plans after federal tax credit expired, according to Congresswoman Jennifer McClellan.
Now, these health care cuts scheduled to take effect at the end of the year will hurt people who are most in need.
Those tax credits helped lower monthly premiums, but without them, many families are now paying significantly more out of pocket.
Too many people are having to choose which bills to pay and gambling that they won't get sick or injured.
For some, like Virginia resident Laura Bueller, those rising costs are already hitting home.
My insurance was $15 a month. It has gone up to $115. That is roughly 1/3 of my monthly grocery budget.
Advocates like Kenda Denia of Birth and Color say the impact could be especially severe for women, particularly when it comes to maternal health and preventative care.
These cuts will force women to make impossible choices, choosing between groceries and doctor's visits, between rent and prenatal care.
Leaders also warn the ripple effects could strain hospitals and local health systems already under pressure.
It is also putting our rural hospitals and our safety net hospitals at risk.
For those who've lost coverage, there are still options. You may qualify for a special enrollment period through healthcare.gov if you've recently lost insurance. Some Virginians may also be eligible for Medicaid, and free or low-cost care is available through local clinics in the Virginia Department of Health. Advocates say without action, more families could be forced to choose between paying for care or going without it. For 13 News Now, I'm Jordy Clark.
And we also have a full breakdown of today's announcement and what it could mean for Virginians on our website.